Thank you so much for inviting me to talk to you today about the future of nursing and our campaign for action, an initiative to improve health and healthcare through nursing. This campaign is about transforming healthcare for you and your loved ones and for the patients you serve every single day. There is no greater calling or privilege than nursing. I know that nursing is a highly respected profession in the Philippines, and the entire world benefits from nurses who provide care to people throughout the world. I want to talk to you today about the future of nursing and our efforts to improve health and healthcare through nursing. Our efforts began in the United States, but our report, The Future of Nursing, Leading Change, Advancing Health, is having a global impact. Over 146 countries have downloaded the report, and many countries are trying to implement the recommendations. I'm delighted that the Philippines is too. I strongly believe that now is the best time to be a nurse, but there are lots of changes we need to make to improve health and healthcare. We need to increase access to care, we need to improve quality, and we need to contain costs. Quite simply, we need to rethink how we use our resources and how we provide care. We can address these challenges now by maximizing the use of nurses. That means we need to prepare nurses to meet the health and healthcare demands of today and tomorrow. As the largest segment of health and healthcare workforce, the ones who spend the most time with patients and their families, nurses are vital to the successful transformation of healthcare. Nurses, nurses are at the center of many of the innovations we rely on to increase access, improve quality, and contain costs. And nurses with strong clinical and leadership skills can help promote wellness, develop new models of care, manage care coordination, and help to reduce medical errors and rehospitalization. They can also utilize quality improvement mechanisms and engage diverse partners in community assessment. This campaign seeks to improve health and healthcare through nursing. This campaign envisions a healthcare system that offers all Americans access to high-quality, patient-centered care where nurses contribute as essential partners in achieving success. We're working to address our nation's most pressing health and healthcare challenges, access, cost, and quality, by utilizing nurses more effectively and preparing nurses for the future. The campaign provides a voice and a vehicle for nurses to lead and manage system change and make sure those we care for, whether in hospitals or in the community, get the care they need when they need it. The campaign is a joint initiative of AARP, the largest consumer organization in the United States, and the Robert Wood Johnson Foundation, where I work, the largest healthcare philanthropy in the United States. The campaign has mobilized diverse health and healthcare stakeholders nationally to help implement the landmark Institute of Medicine's evidence-based recommendations on the future of nursing. The campaign includes a wide range of providers, consumer advocates, and policymakers, and the business, academic, and philanthropic communities. This campaign seeks to strengthen education, training, and diversity by enhancing the capacity of nurses to manage increasing numbers of diverse patients with multiple health conditions in a more complex healthcare system. That's number one. Number two is to expanding access by eliminating barriers that restrict the ability of advanced practice registered nurses, physician assistants, and others to provide primary care. Number three is improving quality and coordination by promoting interprofessional collaboration among healthcare professionals and others in the community. And lastly, leading healthcare change by developing more nurse leaders to direct and manage system change, promote prevention, and contain costs. Over the last 2 years, we've built a strong national infrastructure here and grassroots organization in all of our 50 states that's intended to last many years. We've got diverse partners, as I mentioned before, actively engaged, including healthcare organizations, business leaders, foundations, and consumers. I always tell our coalitions here to look at all of the recommendations and determine what they want to work on, and then determine who they need to bring to the table to implement relevant recommendations. Nurses are at the heart and soul of this campaign, and they have the experience. But they do not have all the perspectives, resources, and power to make it all happen. We need everyone. We've got a new website that you should check out, www.campaignforaction.org. It offers an online community that brings together people who want to advance our work, news on the campaign's progress, and state pages showcasing the work of each action coalition and evidence. You can share the latest news. We'd love to hear from you. Listen to webinars hosted by leading experts, learn about upcoming events, and ask questions and find resources and tools. We're off to a great start, but we can't do it alone. We need all of you to join this campaign. It would be great to have you. Let's make this a global effort. Figure out what part of this report is relevant for nurses in the Philippines and develop your own campaign. We need your voices as well as your time and talents to succeed. We need your help to improve patient care. So go to that website, again, campaignforaction.org, to sign up and get involved. As nurse leaders, there's also a lot you can do. You can incorporate the recommendations into your organization's strategic plans, like many of the organizations here in this country are doing. A 2010 Gallup poll of 1,500 opinion leaders said that they wanted nurses to have more influence in a variety of areas, especially in reducing medical errors, increasing quality of care, and promoting wellness. They also believe that nurses should have more input and impact in planning, policy development, and management. Incorporating the recommendations into your strategic plans is a great way to get started. You can promote nursing leadership. If there's a new piece of technology being considered at your facility or a new quality improvement program that will be tested, make sure that nurses are involved in the decision-making process. Ensure that a nurse sits on the committee overseeing it. It's equally important that you foster leadership. Leadership begins with mentors. Make sure your organization has mentoring programs for nurses at all levels so that they can become leaders. We need to improve patient care. A strong culture of mentoring begins with you. And leadership needs to happen at every single level. Make sure that your culture enables nurses to take responsibility for identifying problems and areas of waste. They need to devise and implement a plan for improvement. Then they need to track the improvement over time and make any necessary adjustments. Those of you who work in the community can make sure that your nurses provide solutions around constrained resources or better ways to care for populations. Encourage lifelong learning. Make sure that you know everything in the IOM report on the future of nursing and translate it for your staff. They need help in that translation. Share the main findings from the report with your leaders and directors, so manage down and manage up. You can also develop plans for how you can assist your staff to achieve academic progression. Promote policies such as flex time and tuition benefits that make it easier for nurses to return to graduate school. Practice interprofessional collaboration. Be a team player and encourage greater collaboration among all relevant providers who have a stake in caring for patients and populations. Florence Nightingale once said, "May we hope that when we are all dead and gone, leaders will arise who have been personally experienced in the hard, practical work, the difficulties and the joys of organizing nursing reforms, and who will lead far beyond anything we have done." We are the leaders now that Florence Nightingale talked about so long ago. We need to step up to the plate in her stead. A few years ago, I fulfilled a lifelong dream in traveling to the United Kingdom and Turkey to follow in Florence Nightingale's footsteps. I brought a replica of the lamp she carried. Her lamp has become my renewed symbol for how we as nurses might play a more active role in improving health and healthcare in this country. We've got an opportunity to take up her mantle of leadership. We owe it to all the generations that follow to address and adopt these recommendations. It's up to us while we are still alive and have the wherewithal to do what Florence Nightingale did. Gather the influencers, grab the blueprint for how we might get this work done. Stay away from the naysayers who say we cannot do this. Stay focused and make it happen. We owe it to patients and their families and us to do our part as solutions makers. So join our campaign. Again, campaignforaction.org. Together, let's improve health and healthcare through nursing. Thank you for inviting me for these few words, and good luck with your conference. Bye-bye. Let's do it.